Well, it's a pleasure to be back here. Have any of you heard me talk about the book? Good. So I'll talk a little bit about the book and then about the co-op. How long do we have till?
You have 3 hours. No, until about an hour, until about
Okay.
1:20.
Okay. And I'll leave time for questions. Certainly interrupt me as you see fit. It's nice to see Dr. Geyer here. I purposely dressed like him, for those of you who know. Like he. And several of my med student friends are here. Mary Catherine, hello. So I'm going to tell a story. How many of you have seen The Wire, or parts of it? Wow. Well, I teach a class called Baltimore on the Wire at Hopkins undergrad, and that's where this book idea came from. But let me tell a story which actually could easily have been in The Wire, but was actually a true story with the name changed to protect the gentleman that I'm going to mention. Anyway, it's a story about a kid named Corey, who's 14 years old, and came to us in a project that we did called Operation Save Kids in November of 2002. He was a young fellow who was the head of the McKean Avenue Boys. Anybody here from Baltimore? You know where McKean Avenue is?
I know where it is.
Yeah, it's tiny.
Yep.
So McKean Avenue, he's the top of McKean Avenue Boys, a 14-year-old. The head of this group. When he came to us, he was truant 90% of the time so far in that school year. When we visited his house, he was living with his maternal grandma, who was a significant substance user, and his half-brother from his mom's side in a row house without any heat or electricity, with the exception of a jerry-rig, whatever the term is, to the next door apartment to get a single heater. There was virtually no food in the refrigerator. It was very cold. It was late November, just after Thanksgiving. He came to us as part of a project, like I said, called Operation Save Kids, which was set up to try and prevent 32 more juvenile homicides in 2002, considering that in 2001 we had 32 homicides of 17-year-olds and younger in Baltimore, which put us not only at the highest rate, you guys all obviously know what this means, but actually the highest number in the country, more than we believe New York City, certainly more than other big cities as well. So Mayor O'Malley, who was the mayor at the time, asked me and the police commissioner to do an analysis of these 32 kids that had been killed. And you can probably guess, I'll just run through it. 4 of them were girls who were accidental shootings because the boy, the friend, was the target. 28 were boys. They were virtually all of them were shot. Virtually all of them with large bore weapons, with gunshots to the head and torso, with stippling marks. Literally, they were clearly assassinations, and they were all involved in the drug trade. A couple of you, I don't know, Mary, were you? I don't know if you were involved with the analysis, but anyway, some of you may have been. Certainly, Steve Terrett's group was part of that. So we had to come up with a program that was partially based on a project in Boston called Operation Nightlight. That went after, with incentives and disincentives, went after gangs in Boston when they had a much smaller number of juvenile homicides. So we set up this project called Operation Save Kids, which had 2 major components. One was a KidStat meeting, which you guys know, if you watch The Wire, you know what ComStat is. It's the police holding everybody very tightly accountable, making them throw up because they're so nervous. Normally I didn't do that, but we had 7 or 8 different stat processes in the health department, which actually are very useful, just as an aside, because Bernie reminded me to come back to where I am, as an aside, when I talk about KidStat. So one of the things I've learned, and Bernie was, of course, high up in the Massachusetts Department of Health, and I'm sure several of you have worked in health departments as well, is that as the health commissioner in both Baltimore and Howard, you'll meet with your assistant commissioners, let's say monthly. You meet with them frequently as a group, but you meet with them one-on-one, let's say every 2 months. And something inevitably comes up, and you miss 1 2-month period, and so it's 4 months, and then they miss something, or they're sick. And so 6 months goes by, and you really haven't focused on the issues that they're supposed to be working on and holding them accountable and being kept aware of what's going on. So we started these stat processes, which every single week, whether it was lead, following lead paint poisoning and how we abated houses, in lead stat, whether it was drug treatment centers and how their outcomes were improving or not improving and holding them accountable through drug stat, or in this case, KidStat. We kept the pressure on, if you will, to make sure that we were following the data and following up what was going on with these kids. So we had a kid stat process where all the decision makers in the city on kid issues, if you will, participated, and it was required. Every Tuesday at 10 a.m., it was literally sacrosanct. We met and discussed all new kids coming to the program and all difficult kids who were continuing to have problems, as well as always a good result, because he didn't want to get too cynical. So we had the head of homicide for the police department. We had the chief of the juvenile justice system. We had probation officers of the kids that we would get. We had the placement person from the education system, so that if we needed to move a kid, they didn't have to go through 3 levels of bureaucracy and come back 4 weeks later. They could actually make a decision there. The drug treatment system, et cetera, et cetera. So we had this kid stat process, and then we also had an outreach case manager process where we hire people from the community to serve as case managers. The best person we actually ever had was a woman who had 2 of her children shot and killed in separate incidents, who served as one of our case managers. And they followed the kids wherever they were, whether they were in school, at home, out in the streets, whatever, and tried to make sure that they were doing good and not bad. So we had these 2 processes, and so Corey came to us as the first of our kids in Operation Save Kids with these criteria that I mentioned. And in addition, I should mention that he had between 12 and 14 arrests for distribution charges and handgun charges. So we had set criteria for who was entering the Operation Save Kids program as being those most likely to shoot or be shot. And we had criteria that we came up with based on what we had done in the analysis. So that was Corey. And he came to us. I'll be Socratic. So, Mary Catherine, what does he need and his family need right away?
Counseling.
For? Like family counseling?
Yeah.
Yes, so we ended up doing MSTF, MSFT, multisystemic family therapy after a period of time of running the program, and we realized that that was a very important adjunct. We didn't do that at the time. What else does he need? Stable housing. So we got, housing department was there, the deputy director of housing got emergency assistance for food, electricity, and we actually worked with as it turns out, his paternal grandparents were working class folks from the east side of town. They lived on the west side of town, Corey. And they were willing to take in maternal grandma and Corey if maternal grandma got clean, even though they had never met maternal grandma, because Corey's mom and dad had only met once. Any other things that you would do?
Education.
Yes, so people, places, and things. You want to get people away from the people, places, and things that are problematic. So getting him into another school, preferably on the east side of town near his grandparents, that was done, what could have been done immediately. But there was a stumbling block. Grandma refused. Why? That was part of it. Sources of drugs, getting closer. When in doubt, it's always politics or money. So she was a DSS guardian, and she was afraid that if she went to residential treatment, she would lose guardianship and would lose the money coming with Corey. So we had DSS there, Department of Social Services, and agreed to keep it going. So anyway, I'll cut to the chase. 3 months go by. Grandma has been in residential treatment for 28 days. She's clean. She's now in outpatient treatment. She did move in with the grandparents, the other grandparents. Corey switched schools, moved to the other grandparents' house. So obviously they had stable housing, food, a livable wage income. And Corey was no longer, as far as we could tell, carrying a pager. This was just before cell phones came onto the market. And he was in school 95% of the time. So sort of a success story, and our first one, which was wonderful. Until February 14th, about 3 months after we got him, I had this police pager. Eddie Norris, who some of you may remember, was the police commissioner, and as we wrote in the book, a curious perk of the job was that I got to carry the police homicide pager, which was interesting, but not that I could do much about it. Anyway, on Valentine's Day, we got a page that a 14-year-old had been shot and killed on the west side of town. And Corey was on the east side of town, and we had very few kids at 14-year-olds at that time. It was still early in the program. So we just thought it was, a tragedy, but not one of our kids. But it turned out it was Corey. And he had gone back to his old haunts to see his little half-brother's birthday party, because the half-brother was from the mom's side. So he stayed on the west side. Oh, and by the way, mom was Mom was dead due to HIV/AIDS related drugs, and Dad was incarcerated in South Carolina due to drug trade. I forgot about that. So not a totally atypical kid or situation at all in the city. So anyway, he was killed by a 13-year-old because it was known who the shooter was, and the 13-year-old had had a beef with Corey from back 5-6 months ago at their McKean Avenue boys' time. You know the lawyer Levy in The Wire, the sort of slimy lawyer? Well, the 13-year-old got a slimy lawyer, got him released quickly on bail, even though we got him picked up immediately because they had an open warrant and we had the homicide team we had an emergency Ptsd meeting, got the kid picked up right away, but he was released on bail. He was shot and killed by Corey's 16-year-old cousin and running mate, who were then shot by the rival gang. So without trying to be terribly cynical, it just goes to show, the reason I talk about this in the first chapter is although this is actually an anomaly, of all the kids that we've served, unless I'm not completely up to date, of all the kids served in Operation Save Kids over the last 10 years, I believe it's the only homicide related to them. There have been some recidivism in terms of behaving poorly, but this is actually the one truly tragic incident. But it highlights the fact of how incredibly difficult these kids' lives are, and how even when you bring all sorts of resources to bear that would not otherwise have been brought on all kids, they can still have difficult outcomes because of how they were brought up and what the place they come from. So I know there are a few of you who just listened to me, so bear with me. But it just seems to me that we can't, too many people look at these kids growing up in the city and saying, why don't they just pull themselves up by their bootstraps? Or we made it, my family made it, and we're out in the suburbs and we got educated and stuff. But these kids' lives, as Bernie and many of you know, are just so incredibly chaotic, with changing constellations of family members of different types, with changing school, literally 45, Dr. Alonso just spoke to my class last week, something like 45 or 50% of all kids in elementary and middle schools are in a different school every year. So if you're a teacher or a principal or a guidance counselor, you don't keep the kids because they keep moving and moving because they're so transient living with different family members. That unlike generations before where there was the family support to be able to help people with their bootstraps, there just isn't that kind of support, and oftentimes in many places in the city. So that was Corey's story, and it also highlighted for me, along with my move to Howard County, the ultimate importance of place mattering, that place matters. And we can talk a little bit about that, and if you wish. Throw out questions, because I spew this out constantly every day. And yes?
Supposed to remind you when to sign.
I already came back, thank you. Yes. Thanks. I usually go way off on tangents and never come back, so. And this is sort of stream of consciousness. As those of you who know me know I just go do this, so stop me if you want to ask questions. I went from Baltimore City, which is obviously its own county. For those of you who live here, you know that. There are 3,570 counties in the country, and I went from the 5th poorest county in the country to the 3rd wealthiest county in the country with 12 miles between my two offices. I still live in the city, but worked in Howard County up until just a couple weeks ago. And it is the single best support for the fact that place matters, otherwise known as the social determinants of health. I would argue that this, without dissing too much my previous colleagues, although I probably will, the teachers, the principals, the superintendent in Baltimore City are at least as good as those in Howard County. People try just as hard in Baltimore City as they do in Howard County. The problem is that the socioeconomic status of the vast majority of people in Howard County is just so high compared to the city that it's an unlevel playing field, and so the outcomes are just vastly better, from excellent school system, often ranked in the top 10 in the country in Howard County. In Baltimore, we're struggling constantly. I think it's better than it has been. Housing, recreation and parks. I mean, I've coached 35 seasons of rec league, and I live in the city, and not one of those teams has ever been from the city, because there's just so few rec leagues in the city. I coach out in the county. Whereas in Howard County, there's immense, anybody from Howard County? Yeah, I mean, Lenny knows, there's just immense opportunities of inexpensive or free recreation facilities. The library is the best in the country, where 94% of people in Howard County have a library card. I mean, talk about the city that reads, for those of you who remember when Mayor Schmoke was here. That's the county that reads. I mean, literally 94% of people, and they use them. They're beautiful libraries. So you get the picture. And of course, everyone, or almost 90% plus, have livable wage jobs or much, much better paying. So it makes a real difference, and it sort of led me to my conclusion of the four-legged stool, then I'll get off what I was talking about earlier, which is not rocket science, and certainly I'm not the only one who's ever said this, obviously, but it's been sort of a useful analogy, is that in order for a community to be successful and healthy writ large, you need access to healthcare and healthy foods, i.e. no food deserts or get rid of food deserts. Second, decent, appropriate, safe housing, including public safety. Third, a solid education, public education system. And fourth, and most importantly, the availability of livable wage jobs accessible to people in that community. Not minimum wage jobs, livable wage jobs. And if you have those four things in general, you're going to be much more likely as an individual, as a family, as a community to be successful. And I'll give one example, which I gave before, which I should probably stop apologizing for, because none of you know what I'm talking about except for the 6 people who were there. So a quick example, some of you may have heard of Healthy Howard, our program for the working poor of Howard County, where we, along with San Francisco, I think, are the only jurisdiction that had this kind of insurance product for working class families who made too much for Medicaid and not enough to buy health insurance. It actually was quite successful, but it was brought up to me many times, why don't you just bring this back to the city and do the Healthy Howard thing in the city? It'll really help these neighborhoods become whole. And the point is that in Howard County, all they were missing was that one leg of the stool, to be simplistic about it. These families did have livable wage jobs. They didn't actually pay for insurance, but they had livable wage jobs, as it otherwise would be described. They had an excellent education system for free, public education. They had decent housing that was safe and lead-free and mold-free, partly because it was so new. Most of Howard County is new housing. And fourth, and lastly, we provided them with that last leg of the stool, healthcare. But in the Middle East, just above here, you can provide the world's greatest healthcare. In fact, in some ways, at least tertiary care is the world's greatest healthcare from Hopkins. I would argue they don't have great primary care, but regardless, if you brought that there to Middle East, they still have cruddy housing in general. They still have a very poor public school system that they can get to, and they don't have livable wage jobs in any large numbers, particularly in the neighborhoods. So just bringing health care is not enough. You've got to do all those things. And I would argue that the leadership of our city has not exhibited the political will to do those four things in any real holistic way for over a decade. Instead, we support things like the Grand Prix, which if the resources that were devoted to that in time and effort and money, knowing it would be a money loser, by the way, which it was, were instead spent on tax credits for companies setting up in neighborhoods that pay livable wage jobs, which would cost much less and end up turning out more productive people who would then pay taxes, would be a much more useful use of our city resources. But that has not happened. Questions? And I can move to the co-op, I guess. Yes, sir.
Yeah. My question is about the role of, a lot of us would argue with some of the factors you're talking about, but in terms of, it sounds like the situation you presented with the 14-year-old boy, there's a lot of family instability, and particularly with young children, the importance of having some stability in terms of then guidance as they grow. I'm just wondering, what policies or what ways and what factors that play, and then what social policies do you see perhaps?
Actually, it was some of the questions that came up earlier. So first of all, we did learn after the first year that it would be beneficial to deal with we didn't just deal with the kid in a vacuum. We obviously dealt with family issues as well, but multi-systemic family therapy, which is really intense therapy with whoever the constellation is that make up that kid's family, actually was significantly improved outcomes. So that's policy, if you will. The other thing, though, is much bigger issues. It's dealing with teenage pregnancy and keeping kids, parents at least talking to each other, if not married. And it's cultural mores and all sorts of stuff. So we couldn't really address that specifically, but getting the family constellation dealt with and this therapy system actually worked quite well.
piggyback off of
Yeah.
that. What do you see as the policy levers in this city that could alter those priorities? Are there any?
Yeah, I mean, the way that we, we go to Annapolis for lots of money, and I think there needs to, well, let me think how to best say this. Let me think about this for a second and I'll get back to it while I'm taking another question.
Okay, hello. I have sort of a two-part question. So when we discuss social determinants of health, we know that psychosocial determinants, factors are part of that. And so when we have the family structure missing, we can rely on other psychosocial factors like role models.
Mhm.
And then when we look at the demographics of Corey's environment, he may not have had that family structure. The next best thing would be a mentor. And for a young black male, his mentors, they're facing, other issues. So what I'm getting to is that when we look at policies supporting or not supporting re-entry so that those role models can successfully come back into
Right.
Corey's environment, that can at least help to alleviate situations a little
Right.
bit.
So this gets also back to your question. So we've invested huge resources in facilities and programs that kind of expect folks to fail, particularly young minority. Well, it's actually young majority now, right? So the short term, I would say reentry program is great because we want to bring those folks back into the community and be productive, but we want to get earlier than that. And so I actually used this example earlier as well, but how many of you know about the juvenile jail that's being discussed? Insane. It is true that the kids charged as adults and waived up to the adult system in the Baltimore City Detention Center with the bad guys the Department of Justice found that a big problem, and obviously we had to correct that. The way to correct that is not to build a new juvenile jail which expects kids to fill it. There are about 42 to 45 kids at any given time who are truly waived up to the adult system. There's plenty of room in the Juvenile Justice Center right down the street here in one of the pods to take care of those kids in a very secure way and have rehabilitative services for them as well. To build, so this relates to what your question was. We are building things expecting kids to fail, expecting kids to be criminals, and not investing in early education. Head Start, I don't know, it sort of works, sort of doesn't, it's hard to tell. I've read all the meta-analyses. My mom was a big Head Start person, and so she says it works great. It apparently works for the first 3 years, and then it does some, whatever. Anyway, early childhood education, STEM education, knowledge-based, what would you call it before? Knowledge-based economy type thing. That's what we should be, so there's $100 million for operating budget for the jail. Why are we spending, that's a lot of money in Maryland. And the governor will claim and the mayor will claim per what the political will is. The mayor and governor are all for this jail. But it's a ridiculous waste of money. And it's, again, as I've said 3 times, it's expecting people to fail. So we need to change our thought process. And it's not just black or white. I mean, the mayor's black and the governor's white. It's that we have to expect our kids and push our kids to be successful and to offer not just programs, but sort of a cultural change, which is not necessarily done just by politicians at all. That it's racism. We are kids, we expect our kids to succeed. And that's a whole change that the society has to make. And one of the things, actually it is turning out a lot like what I just talked about, but one of the things that gives me some hope, because I think that the people my age and older are relatively hardwired towards this. They just don't see things changing terribly much. But younger folks are much more multicultural, much more pluralistic for a variety of reasons. And you can see that in the polling on a lot of things, from gay marriage to other issues, that they're just, the 30 and unders are just vastly more, look at the country as it really is instead of people my age and older who look at it as it was. And I mean, I don't, but many do. So I think in 20 or 30 years that will change. All this will change. But I don't see it changing super fast. It's a long, convoluted answer to I'm not sure I answered the question. But.
just following up on this, where do the after-school recreation, community-based programs fit into the four legs that you have? Because I think that you can have health and education and the other two prongs, and without those after-school, out-of-school opportunities, job skills, leadership development, you can still have children that fail. So where does that fit into your paradigm?
Partly under education, partly it's only a four-legged stool because I could actually make it a six-legged stool, but that doesn't really work very well. And public safety, safe environment. But your point is well taken, although I would argue that if it gets to the point, I mean, I grew up in LA and went to public school, and my public school was actually quite diverse. It was not so diverse socioeconomically, but racially very diverse, particularly there in Sacramento. And I didn't need after-school activities other than, you know, a lot of the kids didn't need after-school activities. If you have a really good education system and involve parents, that may be enough. And eventually those four legs would get you to that, but in the meanwhile, you do need those sorts of things.
We just completed a study of kids in Eastbrook, a qualitative study, and the sort of major finding is that the kids do not feel safe anywhere. They don't feel safe in school, they
Right.
don't feel safe at home, they don't feel safe on the street. So there's this sort of violence that's permeating the community, and that's what got Corey.
Yeah, have you heard of John Rich? You guys know John Rich? Wrote a great book called Wrong Place, Wrong Time.
Yeah.
He got a MacArthur Fellowship, the greatest thing of all time. I would love to get a MacArthur Fellowship. I'm sure everybody would. I think I'm now too old for it. Anyway, he got a MacArthur Fellowship where they just deign you as a MacArthur Fellow for the good stuff that you do. In Boston, I think he was at Boston Children's. And he was a pediatric ER guy and came across this kid who was shot and started talking to him. It relates to what you were talking about. And from that grew a book where he interviewed and kind of got involved in the lives of these kids to find out what was going on with them. And it was very interesting, which stuff I'm sure you all know. First of all, there was a huge prevalence of PTSD and depression. And the way that these kids reacted was not to become hyper reactive in general, but they became so when he would interview them, they'd be like, yeah, I was shot, and I was shot in the chest, and then they took me to the hospital, and he's like, why are they were completely deadened, or they were hyperreactive, and so there was a combination of both. Like when someone would come upon them in the street, as with anybody with PTSD, they'd be hyperreactive and shoot or run or whatever. But then they would react in such a way that the medical professionals, I don't know how many of you guys have done this, remind me your side again, professionals. So when I was at Emory Med School, and we worked at Grady Hospital, which is one of the sort of charity hospitals like Bellevue, Cook County, blah, blah, blah. And I can't tell you, it got to the point where all the ER residents and docs were making light of the patients, as in a lot of these books about docs and stuff, where, you know, a patient comes up and he comes in, he's stabbed. How'd you get stabbed? Oh, some dude just walked out of the door and stabbed me. And, you know, you talk to someone who had been shot and they'd be all callous, and you had very little sympathy for them. But so how these kids reacted was kind of compounding the problem that they already had, because the professionals, social workers, docs, nurses, weren't caring about them because of the way they were reacting. So it all kind of ties together. The lives that these kids lead are just completely different, even from those who lived in abject poverty and the depression, et cetera. It's just, I mean, I don't know how many of you guys do home visits. I've done a ton. Yeah. And they live in places that you shouldn't live. Just the physical part of it. Forget all the emotional and the constantly changing family. Yes?
I actually have a question about like the physical structures of Baltimore. I think that's something that kind of marks the city when people come who haven't been here before, like the neighborhoods with such a huge number of vacant housing and burnt out housing. And like, when we think about improving neighborhoods, I think that the private market can't, like the houses are so dilapidated. I think Fells Point, for example, they, like in the 70s, this was a very different community, and then $100 houses. But how do you revitalize a neighborhood and keep people in it? Because when the houses are not so dilapidated, they become more expensive and push people out?
Well, a relatively good example of how to do it right was Pleasant View Gardens, which is the, where are we? Down Fayette, it's Orleans and Fayette. It's just, well, you have to drive by when you drive by the shot tower, kind of, by the post office. There used to be Flag House and Lafayette Courts. Lafayette Courts were, so these were the high rises that were torn down. And people were given the option of staying in this Pleasant View Gardens, which were low-rise, single, like, what do you call it, dual houses, duplexes. You know that I'm 52, I lose my thought process. Duplexes, and with gardens, and with playgrounds, and with a recreation center, but no one believed really that that was going to happen. It was called the Hope 6 project, and it didn't work in most cities, but it did seem to work here. And then, or you could get a Section 8 voucher and go elsewhere. But the key was, and this is not, it's not like nirvana, it's just that it has worked fairly well. And a pretty good school nearby, and near to the harbor, so it was actually, could have been the exact problem that you're talking about. And there was a lot of fighting going on about, once you tore this down, aren't the private sector going to come in and build the things like Canton is built like now? But it was mixed income, which is useful. And it has the appropriate amenities, and it's a lot about place mattering, that the fact that I don't know how many of you have seen the high rises, but they were disgusting. They were built originally for returning veterans on a temporary basis in the 40s, and they became, havens of unbelievably concentrated poverty and unemployment and drugs, and et cetera, and rats, and they were poorly kept up, and no one would want to live in those places. So so the fact that people were living in places that looked nice and were relatively safe made a difference. So that's one way that it can be done. The second thing is, I would argue, although there's a lot of neighborhood desire to stay in some of what to me would make little sense, is that why would you want to stay in these terrible neighborhoods? There's still a lot of history, and people want to stay. So part of it can be tearing down totally dilapidated houses and putting up new ones that are nice in those same neighborhoods, or encouraging people to spread out around the region, which was done at one point called Moving to Opportunity, but that had a big NIMBY backlash and didn't work so well. Anyway, sorry, you got a question?
I was going to say, I grew up in Lafayette Courts, and at the time, it was many years ago, at that time, the housing was based on income. So you had people, again, you had different levels of income, and the schools were good back then, believe it or not. Baltimore City actually had decent schools years and years ago. But the schools were there, the recreation center was there, the way the housing projects were set up, the recreation, places where the kids play. We're in the centers, so you can look out and see where your kids, it was family oriented. People had gardens, and they actually came and checked to make sure that housing was taken care of. And it goes back to the city having the political will to do what they needed to do, as they saw that things were changing, where it changed from places for families to go and be able to move out at some point and buy houses of their own. And most of the people did that over time, even if their kids were buying houses for them. But then you started having generations of families who got stuck. Right. And they got stuck for all the reasons that you're talking about. And the housing, even the high rises, they weren't the best place to live because they were high rises, but there was none of this crazy stuff going on. That was when there were two-parent families or neighbors looking out for each other. So it was a totally different environment. So people don't know, maybe you read the wire and think, housing projects, they were horrible. They were not horrible. They were a place for people to go to save money and do whatever they needed to move on. So, but they were safe places to go.
Until the last 15 years.
Right, that changed over time, hugely.
One quick socioeconomic point that relates to some of what we've been talking about is when I was a resident or an intern, I was at Union Memorial Hospital, which is right up here, or up there. I don't know where we are, somewhere around here. And it was very interesting to me that the 60 and older guys, this relates to the economy and what needs to be done to keep things going. that Dr. Blum was asking about. 60-year-old and older guys rarely had college degrees, so these are people who came in for hypertension or heart problems. But they had good paying jobs with very good benefits that were livable wage, and they owned their own row house, and their kids have gone to college oftentimes, or community college. And then the 30-year-old and younger, and they were married, and these 60-year-old and older were married, and same wife, or relatively stable families. Not one 30-year-old or younger that I saw. Now there's a selection bias of who comes in the hospital under 30, but regardless. Not one was married, often had multiple kids by multiple women, rarely had a stable job. If they did, it was non-livable wage paying without benefits. And the difference was solely the loss of the blue-collar work, this industries like the Rust Belt industries, the Leth Steel, GM, et cetera, et cetera. So we have to come up, now that's not coming back, I don't think, unless we have another bailout. But we have to come up with some sort of thing, and it's not, what we need to come up with is not just purely knowledge-based economy and jobs. There've got to be the equivalent of these what's the term? The Mervos and Carvers of the world, the VOTEC type things that are that are serving in the future the kinds of things that even electricians and plumbers will always be needed. But VOTEC for the future for everyone, not just minority kids or poor kids, because not everyone fits college. I mean, one of my 5 didn't fit college. I don't want to say that out loud. He knows who he is. But if there was a really good VOTEC program that turned out jobs that paid decently, we need that. We can't, not everyone is going to go to college and grad school and be an academic thinker person. So that's one thing that's clearly necessary, and I don't know if we're there yet. One of the things that's been helpful is the president's pushing community colleges now sort of serve that niche. Anne Arundel Community College is superb at that sort of thing, at some of the sort of, not ancillary, but VOTEC-ish type things. One question way back there.
Yeah, I agree with what you just said, and the fact that often good blue-collar jobs can actually give someone a higher standard of
Yeah.
living. So a lot depends on sort of culturally how we look and value those jobs. But the other thing I wanted to throw in the mix that goes with what you were saying about industry, amongst industry, is also having increased union participation and union representation, because that's where those solid jobs came from for people with just a high school degree, where you got a livable wage, you got benefits, you got vacation and sick leave.
True, but you've got to adjust to what those new jobs are, because a lot of them are not coming back. So I'm not just defending the old jobs is not. You've got to be pushing the unions. What unions should be doing, if they were smart, is finding some of these new jobs to unionize around.
Well, they are fine, but that's what I'm saying, that piece, I think, is what's going to change the new jobs that are coming. And even though they'll be different, but to have them be really a living wage.
I totally agree.
I mean, I just heard something on the radio this morning about a campaign, I can't remember the name of the group, but to give people sick leave.
Right.
And we're so fortunate, you stop and think,
800,000 Marylanders have no sick leave whatsoever, have no leave whatsoever.
Right. So and they're so dependent on the pay.
Right.
So if they're sick, if their child
Right.
is sick, so that's got to change.
And they're having a rally tomorrow at Westminster Hall. Yes.
Yeah, I just wanted to come back to the point that you were making about what the communities were actually like, because I think that a lot of times when I hear the term place matters, people sort of fixate on the structures that are there, the institutions that are there, forgetting that, there are people that make these institutions run. And I too, I'm from Gary, Indiana. It's pretty similar to Baltimore in its trajectory. And my mother grew up in the housing project and is, a nurse, is a single mother. But, even though she was a teenage mom, she was able to become a nurse, meet my father later, who's a physician. I'm here at Hopkins. So it's just the perception of the projects as what they are now, have been in the last 10 to 15 years, sort of misses the boat. And then I think the place matters thing misses the community. And so you mentioned something earlier about businesses coming back as opposed to the Grand Prix. And, it's just, at a certain connection with race rioting and burnout, like the place the burnout came from is like riots after Martin Luther King was assassinated, right? Like that's why the community. Like,
Some of it
that's why
still
people
looks like
left.
that, right?
Yeah, like people left because of those things. So it's like once you have this immense brain drain from the communities that were more holistic, where there were blue collar workers, but there were also entrepreneurs to provide jobs for those blue collar workers. Now we live in sort of a society where we're working in clusters, where people who are, you know, at the higher rungs of the socioeconomic ladder are all segregating along those lines as opposed to segregating along, you know, other notions of community, which was race, ethnicity. So it's just like, at a certain point I understand the logic of we need to bring business back to these communities, we need mixed income, so forth and so on. But I just feel like the market is now pushing us in a direction of, you know, clustering by socioeconomic status, and I'm not sure, you know, what attracts, basically the question is what should attract people who have the education to bring back these neighborhoods back to these neighborhoods. Like I clearly have daydreams of going back to Gary and being one of those young people who goes back and brings the energy, but, you know, I've also seen generations of people trying to do it without much success.
Very good question. Yes? Did you have a question? Do you want to answer? I was going to try and answer the question. So, yes, people have been trying. I would argue that it's still those, so one of the reasons you would want to go back to Gary is when you're a mom, you would probably want to have public schools your kids could go to. So you need to have solid schools. You need to have jobs. So I'm not trying to be overly defensive of the four-legged stool, but you want those things in the community, and obviously community mores make a big difference. And I want to talk about the co-op because that actually is a good segue to it. But I do come back to the reason I'm optimistic is that your generation is much more pluralistic, and it's probably not going to look at things as much along race lines and even class lines quite as much as other generations did. And that's the hope that would be a little bit different, because there always are people, kind of good guys and gals, who come into the city and try and make it, you know, work again. But I think there's got to be a tipping point of enough people coming in that it tips the whole thing. Yeah, yeah.
I want to follow up on what you just said.
Sure.
I think it's really important portion. So, when you think about the institutions of Baltimore, most of them have really failed.
Yes.
And that's the point that you made. I think that's the point of the wire.
Yes, that is.
Most institutions have failed, you know, the poor
Except the
population.
Baltimore City Health Department. Just kidding. When I was there.
And the drug trade.
I was gonna say
the
the
drug
drug
culture in a way is more supportive of these young men. You know, it's a place where they find their own place.
Yep.
In it. Whether it's a good place or not, your risk of dying is high, but you know it's supportive. Okay, so here's where I'm going with. I really agree with this last point. But when you think about what are the successful institutions in Baltimore, they're the universities and the hospitals. You know, they're the only really successful. Industry has abandoned Baltimore. Even the big financial sector here doesn't care that they're in Baltimore.
No.
They just assume be in New York or wherever. But the hospitals really depend on being in Baltimore. Johns Hopkins Hospital can't live without the perception, at least, that East Baltimore is safe enough for people to come to. That's why we have this little army of guards all around us, right? So, what's the role of the big institutions in making Baltimore work again? My own bias, or the only reason I'm raising it, my bias is that they're not playing the role. They eat up a lot of the property and no longer pay taxes on it, right? So they have lots of mixed relationships with the population of Baltimore. We employ a lot of poor people, and we don't necessarily provide them with the best level of wage or benefits or whatever. So how do we get the institutions?
A couple of
play
things.
their role?
First, on your first thing, actually, what I've sort of thought of, and one of my students actually wrote this in a paper. We have thought papers in the class about Baltimore on the Wire. Was that actually the drug trade is its own entire system. It has its own government. It has its own criminal justice system. It imposes fines. It educates the kids in doing certain things. It's the economic engine for a lot of it. So it's actually its own separate institution. It actually is working perversely well. In answer to your question, I think, so Ron Daniels, I think, has the right, I like him, so I should say put that as a caveat, and he teaches in my class. But I think he actually does really care about the community, particularly around Homewood, because that's where he's based, and down here as well. But I think the first thing is like everybody should be paid a livable wage job. I know economically that may be difficult to do, but by having these low-wage jobs that I mean, in Baltimore, you cannot get even a crappy rental for less than $400. I mean, terrible for $400. I mean, when I was in college, $400 actually got a pretty decent place. Obviously, that was a long time ago, but that was in Boston. So you need livable wage jobs. It's like primary. But you've also got to be careful that you don't appear incredibly paternalistic, which has been a problem in town and gown relationships forever. So, you know, Hopkins running a school, it's got to be done really. Is Eric in here? Eric Rice wasn't. He just left. So, I mean, you've got to be really careful. You want to bring to bear the expertise and the knowledge and what works in education, but you don't want to necessarily run the school. And you've got to also have people who have been around for a while. I gave the example of Norplant, which somebody remember from when I was health. So there's things that I could do 6 years after I started because I had a track record with neighborhoods and communities that you can't do in the beginning. So Hopkins has got, whatever Hopkins has got to do, even with the major players at Hopkins, from Ron Peterson to Ron Daniels, introduce this stuff slowly so it's not like appearing top down. I'm not giving a great answer other than I think there is a major role, but it's got to be done very carefully. And there are certain things like livable wage jobs.
Actually, one.
Yes.
So, you know, those of us who worked a lot in the community, particularly East Baltimore. First of all, I don't think it's just an East Baltimore issue.
No.
I think
Maryland has the same problem.
There's
Yep.
enormous presence
Yep.
on the west side of
Yep.
Baltimore. The other big institutions, you know, hospitals, and really have a real, you know, potentially a big impact on what could go on in a place like Baltimore. But people who live in the Baltimore community, I think when they've worked with those of us who teach at place like Hopkins, are totally surprised that we don't actually run the institution. You know, they think that if you're a professor at Johns Hopkins, you've got something to say about real estate policy or employment policy or any of those things. And most of us have no idea how any of that happens, right? So there's a disconnect even within our own institutions. And I would actually say that one of the most powerful forces in our institutions are the students. If students didn't want to come to Hopkins because it was a racist organization or didn't respond to its community's needs, the administration would respond instantly. If the medical school class at Hopkins objected to the way the hospital dealt with
real estate policy,
the administration would. Students are much more powerful than many other components of these complicated institutions because the reputation of the institution depends on its ability to protect.
That's a very good point. I thought you were going another way. I have a class in the spring, which was suggested to me by my TA, and the best student I've ever had, who came up with a community project, a community engineering class. It's a terrible name, but basically it gets kids from multiple disciplines, puts them together in teams to work on community projects that the community has asked for help with. And there have been several of them have put into action. So that, I thought you were going with having the kids out there actually helps to spread Hopkins' goodwill and Maryland's goodwill. But your point is well taken. I will bring that up with my medical students this afternoon. I want to talk about the co-op, so I'll take one more question and then maybe mention the co-op. Yes, sir.
Dr. Beilenson, how you doing? It's good to see you again.
Yes.
You mentioned about PTSD and trauma. If that's the way in to focus on making these kids less violent, growing therapy creatively in these neighborhoods to get these kids at a young age, if they've seen some violence, that's one way of kind of getting it out through therapy. But if they grew up they were raised in a womb and taking crack hits, in the womb, is there a difference in that kind of trauma, and how is that treatable if they've been exposed to drugs in the womb?
I think actually
make them
that's
less
been
violent?
I think the whole crack baby thing has been fairly debunked. As far as I know, I'm not an expert on it. So I would argue that it's, now what you get in utero in terms of anxiety of the mom and stuff, does translate to some extent in neurochemical transmission and whatever. But it's clearly much more, I would say what we want to work on is the environment and what they get when they come out. Let me mention one more quick question and I'll do the call.
I wanted to ask, you mentioned food deserts earlier.
Yeah.
I wondered your opinion on how you feel the city and the mayor really are doing in addressing that.
So this is an example of investing, just what could we do, I guess. I can't remember who asked the question. People who live in the city, of whom there are 640,000, have to do a couple of things. They have to live, sleep, and eat. And they all have, most people have some form of resources, whether it's food stamps or money. And it is, it's completely prejudicial why companies don't operate here, because there's a market. I mean, everybody who, ever think about it, everybody who lives in the city is not starving. Now, there are some people who are food challenged, whatever the word is, food insecure. I admit there's 18% or so, or something like that. But 82% of the people are getting pretty much all the food they need somewhere. And it's either at the corner stores, which are grossly expensive and have crappy food, or it's going out to the county, or out near where we live in the city. So there is clearly the market there, and there should be a huge effort to bring in supermarkets with fresh produce, et cetera, because there's a market here, and I don't understand why it's not pushed for more. I mean, it's lovely to have the Balta market, which is the virtual market where you call things in. Yeah, it serves, what, 500 people? I don't know, 700 people? There are 640,000 other people who are not getting served that way. It makes no sense. So I think that should be a huge priority.
I would mention that
Yes.
there is a new market that's just, I think, the contract has been concluded at Broadway and North. That'll be going in.
And you know what its name is?
Apples and oranges.
And that was from my class. Yes, the kids did that.
There's also a new market that's being negotiated here in East Baltimore.
Yeah, apples and oranges came from Michelle Speaks, who is the March Funeral Home family. She found a place that in Broadway and North, which is a huge food desert. She came to us in this class that I was just talking about, and we had 4 kids work on marketing to the community and helping to set up how that market was going to operate. It's selling fresh produce, it's teaching, it has a teaching kitchen, it's gone, and it's hiring people at livable wage jobs from the neighborhood. This is exactly right. All right, so last 5 minutes, just because you might be interested. So I'll quickly go over the co-op, which does relate to bringing the community together, if we will, because that's sort of the theme here. We need to bring the community together. Under the Affordable Care Act, also known as Obamacare, which we've now taken control of instead of the negative connotation. And of course he won, so we control it now. There is a section of the bill called Section 1322, to be exact, which allows for a nonprofit health insurance cooperative in each state. And we were as Nikki knows, because she's been involved since she was the first year, we put together a proposal that took 2.5 years to be approved because it was a little bit too innovative for HHS. But we just got approval about a month ago, and so that's what I'm doing now. I'm the CEO of this co-op. And it's a nonprofit health insurance company that is a co-op. It's owned by its members and governed by its members, or will be when the members join, once the exchanges go live in October. And we're based on 2 products, if you will. I don't want to sound too insurancy. One's just a typical PPO, provider network. But the innovative part is this model that we have of a set of teamlets, primary care teamlets, and a regional specialty center for each region of the state. And it's based on 3 pillars: a true primary care medical home, getting rid of fee-for-service, all salaried, specialist and primary care, and evidence-based practices and formularies, and a heavy dose of telemedicine. So let me, I could give the example of what I'll give my example again. Sorry, you guys have heard everything I've talked about. So here's the current healthcare system. I'm 52, I have chest pain, it goes away with exertion. Dr. Geyer is my pediatrician. He's my primary care He's my primary care doc. You are a pediatrician. He's my primary care doc. He has 3,000 patients in his panel, which is about normal for primary care. So he thinks it's reflux, or, esophageal reflux, but he does an EKG. And because I'm 52, my grandpa died at 56 of a heart attack, he wants me to see a cardiologist. He gives me 3 names, says it's not urgent, but you should be seen in 3 or 4 weeks. And he doesn't have someone to make the appointment for me, so I make an appointment with Dr. Blum. I go see Dr. Blum 3 weeks later. He does an EKG because he doesn't have electronic medical records and didn't even know that Dr. Geyer was referring to me because I just came with a piece of paper saying I have a referral. So he does the EKG, duplicative, not terribly expensive, but you multiply that 1,000,000 times a year and it starts adding up. He is almost assuredly, even though he's quite sure this is reflux, going to do a stress test, treadmill. Why? Because now, way more than 20 years ago, cardiologists have treadmills in their office, not at the hospital or the outpatient center. They lease it or own it and have to pay for it. So fee for service, I get charged an EKG read, a treadmill read, and a cardiology office visit read. He thinks it's reflux, so now he does what? Sends me to a GI. Let's say he's sensible and sends me back to Dr. Geyer. 3 weeks later, I'm back to Dr. Geyer because I had to make the appointment. He now puts me on whatever, Ptsd or whatever it is, Nexium, and sends me on my merry way. So I'm making it much shorter than it really is. But 3 visits, 6 weeks went by, wasn't even treated with symptoms, unnecessary testing, expensive, not patient-friendly at all. Under our system, we would do the following. I come to see Dr. Geyer, who's in the Towson teamlet, our little primary care team, which has a primary care doc, a primary care nurse practitioner, a medical assistant, a health coach to work on health and wellness plans for difficult, compliant patients, a social worker to do mental health and substance abuse treatment on site in the primary care center, and a care coordinator to make the appointments, and a front office staff person to hire from the community who will serve as a liaison to that community, predominantly the working class neighborhoods who can't afford Medicaid and will still not be able to afford health coverage on the exchange very easily. But we come in 35% below, so we hopefully will be a better option. 1,500 patient panel instead of 3,000. We can do that because we're not fee for service. He's not trying to run through people. We're trying to improve outcomes. He sees me, does the EKG, same problem. Thinks I should probably talk to a cardiologist, so he goes online to our salaried cardiologist downtown at the regional specialty center. Sends the EKG, because we're all electronically connected, sets an appointment 20 minutes with Dr. Blum. Meanwhile, Dr. Geyer goes and sees another patient, sends the health coach in to talk to me about not eating spicy foods, about laying down on a pillow instead of flat because of regurgitation, not drinking coffee late at night, blah, blah, blah. 20 minutes later, Dr. Geyer comes in, we go into the Skype room, which we actually will have, calls up Dr. Blum. Dr. Blum asks a few questions. Dr. Geyer has presented the case. Did you check for mitral valve prolapse? Ooh, I forgot. Dr. Geyer puts the stethoscope up to my chest. Dr. Blum hears it downtown. There are all these specialty telemedicine instruments now that do this. And 90% of the time he's going to say, this sounds like regurg. Just go treat him, Dr. Geyer. Or 10% of the time he's going to say, this sounds worrisome to me. I want to see him today, and the care coordinator will get him down. So let's say 90% of the time, Dr. Geyer gives me the Nexium and sends me out the door. So what's happened, you guys are smart, you get it, one visit, convenient for the patient, no unnecessary testing. If we needed the testing, we got it that same day. It's a true primary care medical home where the primary care doc knows what's going on real time with the specialist instead of just getting a letter back saying, thanks for letting me see Dr. Beilenson, he's healthy. And we not only treated that patient the same day, but they got preventive services that might prevent him from coming back later. So that co-op is, we're going on the exchange to compete with Care First and Aetna and all the big guys, but we'll be much less expensive. October 1, 2013 is when we open for enrollment, and then January 1, 2014 we start our services. So if there are any primary care docs or nurses who are interested, please see me because we'll be hiring them. And we're paying them 5% above the going rate for the state while salarying the specialists lower because we need more primary care docs and they're harder to find. Question in 1 minute. Yes?
What is your plan for evaluation and
We are working on an evaluation plan. Part of it, we collect huge amounts of data as required as being part of the exchange. So we have not yet hired anybody. We just got the money 3 weeks ago. But if you're interested, we'd be happy to talk to you. One more question, or not? Okay, good. Thank you very much.